Hello, my name is Jennifer Hunt, and I served overseas with the Army Reserves in Afghanistan and Iraq. Today, I work at VA helping my fellow veterans get the healthcare they need in the right setting. I like to get my healthcare needs met at the VA. My VA doctor has always listened to me and worked with me for my treatment plans. When VA hasn't been able to provide the care that I've needed, such as with my 2 pregnancies, I was referred to an obstetrician in my local community. For 9 months, I was able to access community care to make sure I had a healthy pregnancy and safe delivery. When I was done with my postpartum care, I returned to VA for my care. Maternity care is one of the situations where a veteran may need care outside of their VA facility. You might be eligible for community care if you meet one of the 6 eligibility criteria. You need a service that VA doesn't provide. There's not a full-service VA in the U.S. state or territory you live in. You are still eligible under the distance criteria from the Choice Program. Your average drive time to VA exceeds certain standards, or you can't get an appointment within a certain amount of time. It's in your best medical interest, and available VA care isn't meeting certain quality standards. The first step is to discuss your needs with your care team. If seeing a community provider is the best choice for your care, your provider will issue an authorization. Once your eligibility has been confirmed, a VA staff member will contact you to schedule an appointment. You may also be able to schedule the appointment yourself. After your visit, your community provider will send the bill to VA or one of VA's contracting partners. If you are experiencing a medical emergency, absolutely go to an emergency room or call 911. Otherwise, there are a few things to remember when accessing community care. You'll need to get VA approval before going to a community provider for most services. You may be responsible for a copayment, the same as if you had received care in a VA facility, for non-service care and for urgent care. Finally, even if you're eligible for community care, you can usually still choose to get care at VA. As a veteran and a VA employee, I've seen the passion and commitment that VA staff have for serving veterans, and I'll continue to choose VA for my healthcare.